This section covers 4 clauses on additional requirements: product design and development, health status, equipment management, food waste. If foods are not created with the right ingredients at the recipe creation stage, subsequent HACCP studies will be ineffective. In other words, if you use the wrong additive or banned substance at the prescription stage, it may be difficult to change a product that has already been released to the market. As we often mention in HACCP trainings, HACCP management alone in the production phase, independent of product development, is ineffective in food production. What you need to pay attention to here is that you do not exclude this process from the FSSC by saying R&D is out of scope in the ISO 9001 standard. In fact, in ISO 9001, product development in production facilities cannot be excluded from the scope. Whether the specification comes from the retail chain or your customer, it is always the manufacturer's responsibility whether you are producing an illegal product. You need a documented procedure that outlines your process. This procedure must cover several key steps: evaluating the impact of the change on your entire food safety system and updating your hazard analysis, considering how the change affects your process flow, identifying any new resource or training needs, and, very importantly, conducting production and shelf life trials to validate that the new product or process is safe and meets requirements. A specific and critical point is for ready-to-cook products. You must validate that the cooking instructions you provide on the label are sufficient to make the product safe for consumption. One real example comes from Taiwan in March 2024. Authorities discovered that 24 batches of imported chili powder contained Sudan red dye, a synthetic colorant banned in food products due to its carcinogenic nature. Section February 5, 14, a requirement specific to Category D, feed producers. You must have a procedure to manage personnel health. This includes, where legally permitted, a requirement for medical screening before an employee starts work in a role with feed contact. Equipment management, which applies to most categories. When you buy new equipment, you need a documented purchase specification that clearly addresses hygienic design and any other legal or customer requirements. Then, for any new or modified equipment, you must use a risk-based change management process to ensure it's installed and commissioned correctly without negatively impacting your existing systems. Your organization is required to have a documented policy and objectives that detail your strategy for reducing food loss and waste, both within your facility and across your supply chain. The clause also sets rules for managing surplus food. If you donate products, you must have controls in place to ensure they are safe for consumption. If surplus or byproducts are destined for animal feed, you must manage them in a way that prevents contamination. All of these activities must be legally compliant and, above all, must not compromise food safety.